My name's Gabrielle Umasella, and we did our project on electronic scripts. So my part of the project was to research the history of electronic scripts, and what I found was that it began in 1986 in St. Louis, Missouri. They erupted as a result of 79 different pharmacies and health systems joining together. It was purchased in 1989 by New York Life Insurance Company, and then they became a publicly traded company in 1992. In 1994, services were expanded by the addition of workers' compensation, prescription services, and reinsurance. In 1996, Express Scripts Canada was started, and also in 1996, the company started the annual Drug Trend Report and Outcome Symposium Conference. In 1998, eScript acquired Value RX. In 1999, they diversified pharmaceutical services that were purchased from SmithKline Beecham Corp. Also in 1999, they purchased stock from PlanetRx.com, and this partnership allowed the purchase of prescriptions and over-the-counter drugs online. In December 2006, eScript made a proposal to Caremark, but they lost to CVS. In 2012, eScripts completed a $29.1 billion acquisition to Medco Health Solutions, and this acquisition positioned eScripts Holding Company as the largest pharmacy benefit manager since they fill 1.4 billion annual prescriptions. The company now employs 30,000 people worldwide, and currently the company has 3 buildings, one of which is 220,000 square feet, where most of the St. Louis employees work. In addition to the other 2 buildings, eScript has a Technology Innovation Center, which deals primarily with the pharmacy. In 2013, they started a new building, which is projected to be done in 2015, and will employ an additional 15,000 people. And this is important because with the way that the world is right now and the economy and everything, it gives a lot of people an opportunity to work. In 1993, the start of annual Drug Trend Report came about, and that provides detailed analysis of prescription drug costs and utilization. eScript came up with its own approach to understand its members' health concerns. It involves the analyzation of behavioral sciences, clinical specialization, and actionable data, and that's probably really important because that sets them apart from other people since they have their own means of analyzing things. eScript fills 1.4 billion prescriptions annually, and all of these prescriptions provide them with information to create better solutions for patients. And that's good because with all those prescriptions, they have diversity in the kind of medications they're prescribing and who they're prescribing them to, so that also makes them unique as well as the way they analyze their information. This is a video that shows you how to use eScript, and it walks you through step by step the process of how the system works and everything.
My name is Brianna Spencer, and I'm talking about general information about eScripts. It began in 1986 and helps make the use of prescription drugs safer and more affordable. It drives out prescription-related waste and helps improve health outcomes. It manages prescription benefits for tens of millions of Americans on behalf of thousands of clients, including health plans and plan sponsors. Express Scripts Drug Choice Solutions facilitate the proper use, selection, and amount of the safest, most cost-effective generics and preferred brands. They have specialists, pharmacists, and nurses that provide personalized attention to patients diagnosed with costly, chronic, and complex conditions. eScripts are an internet-based prescription delivery and renewal management system. eScripts safely transmit prescription data to pharmacies connected to the Pharmacy Health Information Exchange. eScripts only require high-speed internet connection. eScripts meet all meaningful use requirements and is certified for electronic prescribing of controlled substances. eScripts include electronic prescription ordering and home delivery, electronic renewal processing, display of allergies and medications, electronic faxing and mail order, allergy, drug, and pregnancy interaction, comprehensive physician drug reference list, and patient handouts in multiple languages.
Okay, I'm Bridget Bonner, and I did the services that they offer. Some of the types is that eScripts provides services that deliver safe and affordable pharmaceuticals. It can help you save money, manage your accounts online, or gather the latest information about a drug that is prescribed. It helps clients and advisors by simplifying their services. It helps the physicians by giving them access, tools, and resources that help save time and enhance services to patients. And for pharmacists, it provides access to the network provider manual, online claim information, eligibility information, and benefits for the members. Careers, why someone would work at eScripts. eScripts offers a job that can make a difference in people's lives by improving healthcare costs and patients' health. And they hire many people. Many employment opportunities are available to those who are interested in pharmacy, nursing, corporate operations, and information technology functions. And the recruiting team is on social media to answer any questions about possible job opportunities. And this is just one of the forms that the pharmacist or doctor would fill out regarding like the patient's health information.
So my name is Brenda Nugent. I'm talking about the benefits of eScripts. Tens of millions of consumers count on Express Scripts to supply the information and treatment they need to maintain a healthy lifestyle. If your benefit plan includes the convenience of our home delivery services, you can have up to 90 days supply of your medicines shipped to your door. Depending on your plan, taking advantage of home delivery could save you money. Check your plan specifics for details. Once you've registered to get eScripts, you can order refills and renewals, check order status, transfer medicines to home delivery, compare pricing and coverage for brand name and generic medicines, find participating retail pharmacies and compare pharmacy prices, find detailed drug information, and much, much more. Feature availability depends on your plan. Through prior authorization, you can receive the right prescription for you that is covered by your benefits. If it's determined that your plan doesn't cover the medication you are prescribed, you can ask your doctor about getting another medication that is covered. You'll receive it for your plan's copayment, or you can get an original prescription filled at your pharmacy by paying the full price. If your doctor writes a prescription for a 30-day supply of a medication with 11 refills, for a total of 12 fills, Express Scripts will fill your prescription for a 90-day supply of medication in a single fill. You'll then have 3 additional 90-day refills remaining. We refer to this as consolidation of refills. What's important for you to know is that consolidation saves you money by requiring fewer copayments. You have 2 ways to fill your prescriptions, depending on your medication needs. For long-term medication needs, for example, drugs used to treat high blood pressure or diabetes, home delivery pharmacy services from Express Scripts is a convenient, safe way to get your prescription. For short-term medication needs, such as antibiotics for strep throat or pain, relievers for injury, filling at a participating retail pharmacy is optimal.
I'm Samantha Svita, and I'm talking about controversy regarding eScripts. Fraud. New York State Attorney General Eliot Spitzer filed a lawsuit against Express Scripts in 2004. He claimed the company kept tens of millions of dollars owed to the state. He also claimed that the company had overstated the cost of benefits of switching to certain medications. In 2008, the lawsuit was settled. Express Scripts paid $9.3 million to Pennsylvania and 28 other states. They agreed to change the business practices and pay up to $200,000 in reimbursement. Breach. A Missouri man filed a lawsuit against Express Scripts. He accused the company of failure to protect customers' private information. There was no valid evidence, so the case was dismissed.
And this is our works cited page.